Well, hello, New Life friends and family. I want to respond to the update that was just released this week by the Los Angeles County Department of Public Health, which now allows churches to regather. I've got to admit, it came a little sooner than I had expected, but in light of all the safety concerns that this pandemic has created, it's really no easy thing to just reopen our doors to the public. There's much to consider, including the long list of requirements that the Department of Health is asking us to meet in order to be cleared for public gatherings. And on top of that, our church has a significant number of people over the age of 65, as well as those with pre existing conditions, both young and old. So, to say the least, our executive team here at New Life believes it is wisdom to proceed slowly, to not rush back into a public gathering. We're in the process of planning what we can do in the meantime to connect with each other face to face, especially as the summer months are right now upon us. And we'll want to be prayerfully considering the Lord's direction for us as a church. This crisis, as terrible as it is, can also be an opportune time for us to seek and receive fresh guidance from the Lord. Like, we don't want to miss what He's doing. We want to make sure we're right in alignment with His will for us as a church. And so, with that said, we do want to reconnect with you, and we've set up a special Zoom TownHall meeting. This will take place on Sunday, June 7th at 1 p.m. And it'll be an opportunity for us to see each other online, to reconnect with each other, to discuss some of these matters, to answer your questions, and to move forward together. So if you are receiving our weekly emails, the weekly newsletter emails that we send out, the link to that Zoom Town Hall meeting will be included there for now. Now, last but not least, we thought it would be very helpful for you to hear from one of our very own church members, long-standing member of our church. Her name is Maiah Mondy, but she's also a regional officer with the LA County Department of Public Health. So she, in this interview, will be speaking as a health officer. And in this conversation that we have, Maiah really presents a helpful perspective to the issue of regathering, and she shares some insights that will help us act with wisdom and act for the safety of everyone in our faith community. I need you to forgive the video quality. It was our first time recording a Zoom interview and posting it like this, so focus on the content, and I'm sure that you will enjoy this conversation with Maiah. Friends, till next time, stay safe and be blessed. Well, good evening, everybody. This is Pastor Ken, and I am doing this special interview with one of our very own, Maiah Mondy. We have known Maiah for a long time as a family, and not everyone knows this, but she's been a longtime member of our church, faithful contributing member, life group leader. She's done a lot over the years, but some of you may not know this, but she actually works for the Department of Health, LA County Department of Health, and she is one of the regional officers there. And so we thought that in light of all that's been going on, especially since the order that they gave last couple nights ago to churches that they can go ahead and begin reopening to the public, we thought it would be great to invite Maiah into the conversation and to talk about some of this stuff from a public health perspective. And so I want to just welcome you, Maiah, to the table here. And you don't look stressed at all.
Well,
Thank you so much for making yourself available.
That's a compliment.
Yeah, and I appreciate you taking the time to do this. And I want to say publicly here, thank you for all that you do. When we think of the people that are on the front lines right now, we're usually thinking about, doctors and nurses and all the people that are right there in the hospitals treating people. But we don't think a lot about what public health does. And so we want to say thank you for all that you do that some of us really don't understand or see. So we appreciate you. And we want to, I thought it would be good to start with just having you tell us what kind of progress has been made up to this point in this battle against the pandemic. Be nice to start out with some positive news today, yeah?
Sure. So we flattened the curve. I think, people hear that, let's flatten the curve, and I don't know if necessarily people understand it. So flattening the curve just means that we were slowing the spread. So there weren't a lot, because we were quarantined, we stayed at home, there wasn't a lot of exposure. So the cases were not as high as it could have been, which includes hospitalizations and deaths. So because we've been quarantining or staying at home, the cases, the average number of cases, the average number of deaths, as well as hospitalization have decreased. We weren't all infected at the same time, so we didn't overwhelm our hospitals and our healthcare system. And the spread we were able to slow it. It doesn't mean that we're not going to see cases anymore. We will continue to see cases. And as people are out and about, it will, there's going to be continued transmission, but at least we slowed it down, and it wasn't all, at the same time a few months ago or even a few weeks ago.
Right. Yeah, I'll recall that. We'll all recall that one of the main reasons why we started this sort of shelter at home thing and social distancing was to try to give the healthcare system time to really, be able to support the numbers. So you were just mentioning that you're anticipating another spike as, of course, things start to reopen. In your opinion, is our healthcare system in LA County ready for that spike?
Yeah, I think we have capacity. We've been monitoring that on a daily basis. And some people have been infected. I mean, we've already reported a lot of infections from COVID. And hopefully, because the infections happened over a period of time, like I said, it's not going to peak all at the same time. So we have capacity to take care of.
If you are, as from a public health perspective, because sometimes I get these emails, and the numbers I'm looking at are obviously numbers of cases. This is every day, right? Numbers of cases, numbers of death, numbers who've died. From your perspective, which numbers matter to you the most when you look at whether or not we're making progress?
Both, I think, the number of cases and the number of deaths. But I think we could see also, hospitalizations and deaths, because sometimes the number of cases, we can only report on the number of positive cases if they were tested, right? Not everybody is tested. Earlier on, only the symptomatic people were tested. And so that's the people that we're seeing are the sickest people that we think are positive. But really, there are people who are asymptomatic or doesn't show any kind of symptoms. They don't seem sick, but they could be positive. And up until recently, we weren't able to test those people because we didn't have enough tests. So we're finding an increase in cases because we're testing more. But it's important to note that, some of them will recover and that's fine. And some of them, like I said, are asymptomatic, but ones that are really at risk and vulnerable and need to be hospitalized, unfortunately die, that's what we're very concerned about.
You're concerned about, yeah, got it, great. Well, I know there's probably another trail of a conversation that we could have around that issue. But I'd like to focus in on this whole reopening of churches. And I'm listening to the rhetoric, and pastors are trying to change the language here from, we're reopening our church to no, we're actually regathering, because the truth of the matter is the church hasn't been closed. The building's been, closed maybe, or to public gatherings, but the church has been open, the ministry has continued. We've just gathered elsewhere, online. So as we think about what it would look like to regather, like some of us, including myself in pastoral work, we're thinking that churches might not be allowed to reopen until maybe phase 3 or 4 of the whole, plan. Could you tell us a little bit about what factors were influencing LA County and their decision to allow churches to reopen so soon?
Sure. So last Monday, a few days ago, the state decided to reopen houses of worship, right?
Mm-hmm.
So although in Los Angeles County, locally, we can be stricter, we try to make sure, if it makes sense, we try to make sure that we're aligned with the state's guidelines and recommendations so that people don't get confused. And since they reopened the churches on Monday, we decided in LA County to also do that. Last Tuesday night is when we did it.
Got it. So to avoid confusion.
That's correct.
Good.
However, it's still very important, that we ensure the safety and health of people. So there's a lot of guidelines, and I believe you've read a lot of them for you to be able to reopen. There's a lot of things that have to be in place to ensure that the congregation is safe.
Yeah.
I want to emphasize that just because we're allowed, churches are allowed to open, it doesn't necessarily mean that they should.
Yeah, I think that's a very important point. And in fact, as I've been reading through what I was able to access before LA County made their announcement was the state, the 13-page state guidelines, right? And just reading through that, I honestly felt as a pastor, there's no way we could possibly get our congregation or even building or facility ready according to these guidelines, like soon, And so there's already a sense that we shouldn't rush into reopening. But from a public health perspective, what are the most important things for churches to keep in mind as they consider their own preparation process for regathering?
Yeah, so like I said, each church has to make that decision, right? And they should consider the health and safety of the congregation. Mm-hmm. I think if, we have a lot in our church, personally, I know a lot of people that are at high risk. Their population is vulnerable. And I don't think that it would be responsible for a church to open with that if they cannot ensure the safety of the congregation.
Could you describe the high risk category again? So who are the high risk? What is the high risk?
So high risk category are people aged 65 and over, and anybody with an underlying condition.
With underlying conditions.
Pregnant women as well.
Pregnant women.
Yes. People that have respiratory problems, other chronic conditions, other medical conditions.
Regardless of what age.
That's correct.
Just for clarity, what about kids? Are kids considered high risk if they don't have a pre-existing health condition?
Generally, no. Okay. If they don't have a pre-existing, of course, there's some with some, like you said, conditions. Yeah. But just being a kid does not make them higher risk.
Gotcha. Okay, so you're talking about 65 and older and anyone with pre-existing health conditions. This 13-page document, there's a lot to consider, a lot of detail. And there are some surprising things that came up in it that I wasn't even expecting. And so I wanted to see what you thought about some of, like, for example, we're going to have to social distance in whatever room we're gathered in. We have to be limited to, 25% of the
25% less.
Or 100 people, whichever's less.
Yes, 25% of your total capacity or 100 people. Yes, whatever is less. And I think, is our capacity 400?
Our capacity at the Norwalk campus, I believe, is around 350.
Okay.
300, 350. And at Harbor City, it's around 250 roughly.
Okay, so it has to be 25% or less.
25% of that. Gotcha. And so the one question that kept coming to my mind was, can we sing even if we are wearing masks and 6 feet apart in, let's say, a big room like the sanctuary? What what's high risk behavior in the service that we would be opening up if and when we do? Okay,
Mhm.
what kind of precautions do you have with regard to like singing and all of that?
Sure. So we actually recommend against singing at
Okay.
this time, recitation, anything where, okay, because you have to keep in mind, so this is transmitted via droplet, right? So when you
Hmm.
speak, when you sing, when you shout, there's droplets that come out of your nose and your mouth.
Yeah.
And generally, they travel, those droplets travel about 3 to 6 feet. So that's why we're saying 6 feet away, so that when you spew it out, you're within safe distance, right?
Yeah.
However, there's sometimes it travels farther than 6 feet. Like if you're exerting effort, when some people really get into singing, or like or some preachers, they really get into it and exert more. They speak more, they speak louder.
Yeah.
So droplets travel farther. Is it 8 feet, 10 feet, 11 feet? I don't know, but it's farther than 6 feet. But that's the minimum. That's why we want you to be safe, right?
So that's even with a mask on, am I right?
That's without a mask.
Or without a mask?
That's without a mask. And that's why we tell people to wear a mask, so that when the droplets, when you speak and the droplets come out, it doesn't go farther than your mask.
Okay.
And I wouldn't want to be singing with a mask.
The mask.
And I don't think you would want to be preaching
Right.
with the mask on, because your voice, you're going to be muffled. So what's the point of giving a message with a mask
Yeah.
if you're not able to communicate what you're supposed to be communicating, right?
Gotcha.
Whatever, you know what I mean. Yeah.
Right.
So yeah, that's why we recommend against singing. And the 6 feet apart, it's a little bit challenging too, because you can stay close to members of your household, right?
Yeah, your household. Mm-hmm.
So technically, this is things you consider when you try to reopen or regather. You have to ensure people are 6 feet apart. But how do you do that? Do you like put X marks? Do you put tape? But what if you're like from the same household family and you're with your younger child or something, or with your husband I like to sit next to? Are you gonna put 6 feet apart? We don't have to be. So those kinds of things, I think, is a little bit challenging when you're trying to impose social distancing to the country.
Yeah, for sure. In fact, the fact that it feels like you are actually creating, even with social distancing and even with face coverings, you're still sort of, and if you sing in that service, it sounds like you're still creating a higher level of like contagious environment by doing that. So you would have to, cut the singing and just, whatever, preach the message, and then you're good.
Yeah.
So
and then of course, be like way farther. Not that close to them, or don't have anybody sit in the first 3 or 4 rows. I don't know.
Exactly. Well, so in addition to that is the question of, can we even bring our kids back to church? And it's not so much about with them sitting with us in the sanctuary, but if we put them in a like a separate room where they would do what we normally do, like the kids ministry, I don't think parents would be comfortable with having their kids and other kids, right?
Because how do you guarantee social distancing with these kids, right?
How do you do social distancing with kids? You can't.
They're 6 feet apart, and children 2 years and younger, you're not supposed to be putting face coverings on them. So
right.
And that's usually what we would require for people to be in a public place.
So I think it's I guess what's becoming clearer to us is that our sense that we shouldn't rush into regathering sounds like wisdom right now. Would you agree?
I would. I miss everybody. I wish I could see people, but the reality is there is risk when we gather together, because the virus hasn't changed, Pastor Ken. It's the same virus. We still don't have a vaccine. So it's as contagious as it used to be. It's dangerous as it used to be. So if we decide that we want to regather and we want to be around more people, we have to make sure that we're protecting ourselves and others, right? So it's not like we can't go back to how it used to be. And like you said, it's very difficult to, because as a church, you're required to comply with all of the guidelines that, from the paper that you're holding up.
Yeah.
And that's a lot of guidelines that I don't think you can easily comply with. It takes a lot of preparation. Mm-hmm.
It does take a lot of preparation. And so, and on top of that, when you do, let's say we were to comply with everything, even when you hold that kind of gathering, it's not going to feel the same.
No.
I think that for me personally, and I know other people share the same sentiment, that what I miss the most about gathering is the singing, right? Is the togetherness, and you just sort of lose that. And with social distancing and all that. So I think that's wisdom, and I think it's good to just hear it from a public health perspective that, like you said earlier, just because we can doesn't mean we should. Yeah. The other question I had, some people might be asking, what about home gatherings? And as you know, our church has had a ministry, we call it like a life group ministry, where we gather in homes for Bible studies and whatnot. What are the public health recommendations for such gatherings?
So I would recommend against it unless it's very, it's a small gathering with a big home.
Okay.
Be able
How small is small?
Yeah, well, you need to be able to social distance, right?
Okay.
You have 6 feet apart from each other at all times during the whole time. So
with face coverings.
That's correct. So if you can't guarantee that, then I would recommend against it.
Gotcha. And now
it's better, I think, if you're outside and there's more space and there's sunlight and everything. But still, like if it's I think most of our gatherings are at night, right? Like our inside the home. We would really, as well as the health department, would recommend against it. We're not able to social distance.
Yeah. And at this time, though, there is no official number that we have to be limited to if we were to open our home to other people from the outside. Yeah. There is no number like 10 or 12, right? It's
There's
as long
no
as
number.
You can maintain social distance.
That's correct. As long as you could keep 6 feet distance from each other at all times.
Got it. That's just good to know as we think about things. How
just to go back, and you know why it's important, because as we, this is a new virus, but we learn things as we go.
Yeah.
We've learned that, like I said earlier, some people are positive, but they're not symptomatic, right?
Yeah.
They can, and even those that are symptomatic, they're contagious or communicable 48 hours prior to them being sick. So we really know who's sick, and who's transmitting. That's why we have to ensure, that we're careful. And that's why actually we're asking people to wear face coverings.
Yes.
It's not to protect me, the wearer of the mask. It's to protect the people from me in case I'm sick. Like gotcha. I'm having the droplets within my own space.
Gotcha. Thank you for that clarification. As we kind of begin the summer months here, and of course now looking into fall, what is public health, anticipating at this point when it comes to us obviously reopening for the summer, and then I think the fall, the typical flu season that's about to hit. How are you guys looking at all of that, and is there anything that we might need to know?
So as we open or reopen more places, not just churches or houses of worship and retail stores, we're starting to open some of those as people are out and about.
Mm-hmm.
We know we can expect that there's going to be more cases because there's going to be more transmission as people start to regather. So we're preparing for that. We think that we're going to have increased cases. And in fact, if when you read the order for reopening of churches, it says that we're going to reevaluate 21 days.
That's right. I remember reading that.
So 21 days is not like a random number that we came up with. 21. It's 21 days because the incubation period is 14 days, right?
Oh.
So when you're exposed to somebody who's sick, it may take up to 14 days for you to get sick. So for 14 days since your last contact with the sick person, you might be okay.
Yeah.
And so it's 21 days because we're thinking 7 days, for a week, we're going to be interacting, talking to each other, we're exposed to each other. And then it takes another 14 days for you to get sick. And so that's the 21 days.
I see.
21 days, we'll reevaluate. Because if there's increased, if it plateaus, we don't see a real increase, maybe it means we relax the orders some more, right? We lift restrictions. The 25% capacity in church may increase if everything is going well. However, if we see after 21 days that there's more outbreaks, there's increased cases, then it could, most likely, we're going to reinstitute some of the measures that were in place before. And so 21 days is our reevaluation point, reassessment point.
Got it. Especially if within the 21 days, if there are cases that are contact traced back to a house of worship,
exactly,
that's going to be important to know.
And there's been outbreaks. I don't know if you guys have heard in the news. Some churches have decided not to comply with the orders, and they've held services, and there have been outbreaks.
Right.
From churches, yeah.
Wow. Okay, well, so in terms of a vaccination, are we any closer? Is there any news on that front, or are we just waiting?
Well, it's coming. Maybe still a few months from now before the public, general public can have access to it. But
gotcha.
We're working very hard that the vaccine is available as soon as possible.
Yeah. Well, it's definitely changed the way we think about church. And so I think this is just very helpful for us to know. And I think I can say this in this interview that we told this to our congregation last Sunday online, that we're in no rush to get back to reopening or regathering. And what I didn't say was this provides a unique opportunity to reassess and re-envision what the church really might become in the midst of all of this. The fact that we can't gather and it's not going to be the same. We can always gather for the sake of seeing each other, right? And having that social connection that we've all missed so much, even though it's not necessarily in a sanctuary doing a service, right? That's good to know. But in terms of what we do as a church, I think there's going to be, we're seeking the Lord over that, because it's a unprecedented opportunity to explore maybe some new ways of being the church. So in any case, for now, we've got the online thing going. We're making sure people are cared for as much as possible. But like you said, if we do reopen or regather, we've got to say to folks over 65, no one over 65, and no one with any pre-existing conditions and all of that.
Exactly.
Interesting stuff. So.
Yeah, it's difficult because you see the recommendations, Pastor Ken, it says that you have to disinfect very often. That's a lot of work for the church to get somebody to disinfect every time, more frequently than you already do. And then for the frequently touched surfaces, how do you can't even order, not order, but you can't even serve food. We recommend against that because people will be touching the same things. And That's the point. If we can't eat the food that, or you can't serve the food that we want to eat.
You just ripped our heart out.
Yeah. Yeah.
Wow. Well, listen, this has been really informative and insightful. Even just knowing some of it, but hearing it from you, and some new insights that really help us to, I think, to get a handle on the reality. And like I said, it helps to know that public health, LA County, and state of California want to make sure that there's not a whole lot of confusion being spread by this. But every church is going to need to prayerfully decide how they're going to proceed now at this point. And hey, taking off your public health hat, is there anything you'd like to say to the New Life family that is going to be listening to this?
Oh, I miss seeing everybody. I mean, we obviously, my family and I attend the services virtually every Sunday. So I do see the worship team. I do see, which has been a blessing. I do see the pastors and listen to the messages, and I do see the comments from from the live stream. But I do miss everybody. But I'm so thankful for this family that has been available to the congregation, even though, like you said, physically we're not able to gather in church.
Right. Awesome. Well, as we close this time, Maiah, is there anything that we can be praying specifically for you and your team about? How can we be praying for you guys?
I think just for strength, grace, for wisdom. Things are changing very quickly, sometimes on a daily basis, on an hourly basis. So, for us to be able to know how to guide, Los Angeles County, all 10 million of the people here, on how to, keep everybody safe and healthy.
Yeah. Okay. Well, hey, thank you again for your time, sister. And we as a church are very proud of you and how you're working to serve the larger good in this unprecedented time of crisis. And so we are definitely praying. There's a call that goes in every single night of people that are praying on the phone with each other. It's incredible. So I want to just say, thanks for all you do. And in front of everybody, we're proud of you. We know that it's a stressful time, but you're one of the many heroes out there that's really helping us get through this. So
thank you.
Yeah, God's blessing upon you and your family, and make sure you get some rest.
We'll try.
You'll try. Okay. All right, sis.
Thank you.
God bless you.
God bless you too.